My name is Nicole Crooks, and this video will answer questions in regards to my current profession. So without further ado, question one: what kind of professional am I, and what type of training did that involve? Currently, I am practicing as an adult gerontology primary care nurse practitioner. So if we break that down, adult gerontology means that I can see anybody over the age of 12, and primary care means that I typically practice in your outpatient primary care settings. So doctor's offices, long-term care facilities or nursing homes, making house calls, settings like those. In regards to the training, just in nursing general, there are a multitude of different avenues that one can take to become a nurse. Same kind of goes for nurse practitioner, so I'll just discuss the most direct route. First, you would need to obtain your Bachelor of Science in Nursing. Upon graduating with that degree, you would need to take and pass your NCLEX, as well as apply for licensure in whatever state you currently reside in or plan to practice in. I would encourage that you do practice at the bedside for some time to not only build up things that they did not teach you in school, so critical thinking, nursing judgment, things of that nature, but also just so that you as an individual can build your confidence. Nursing school and real life are two totally different things. If you ask any nurse, they can definitely tell you that nursing school is great, but there's nothing like actually being out there and getting your feet wet, your hands dirty, knee deep into this profession that we call nursing. So once you're confident, like I say, within your skill sets, within your critical thinking, just your confidence in the knowledge, your confidence in, talking to patients and families, things like that, then I would go ahead and look at your master's options. Go ahead and apply to those schools, obviously get accepted, graduate, that whole shebang. And then the same goes at the completion of that program. Upon graduation, you do have to sit and you have to take boards again. Once you pass boards, you can then apply for licensure, like I say, in either the current state that you reside in or whatever state you plan to move to. Typical day for me has varied throughout my course of being a nurse practitioner. When I first started, I was in long-term care facilities and or doing house calls. So my day typically was I would wake up. There was really no time for me to do anything. So yes, I needed to get my visits in, or yes, I needed to see a set number of patients in a day, but the timing of when I did that throughout the day was completely up to me. Typically for me though, I would be in the long-term care facility by 9:30. That way I could go in, do what I needed to do, and still be home at a decent time. Same goes for making house calls. I would have my set patients that I would need to visit over the course of the day, but the timing of when I actually did that was completely up to me. I'm the type of person, though I'm not a morning person, I do prefer to get up first thing in the morning, go see my patient so that I can then be at home. Most currently, I practice in a clinic. The clinic hours are 8 to 4, so I work 8 to 4. The biggest difference and the biggest transition for me going from working in long-term care facilities to now working in a clinic is the time structure. So obviously in a clinic / doctor's office, patients make appointments and they come in, and that's what time they expect to be seen by their provider. So now, whereas I was working more so freely to do what I wanted when I wanted, now, like I say, everything is very time structured for me. Throughout the course of the day, the clinic that I am allows us to see up to 10 patients in a day. So we get our list, and I might have an 8, 8:30, 9, 9:30, 10, 10:30. So like I say, I have to make sure that I'm getting in the room, getting the information that I need so that I can, be ready for that next appointment when that next appointment comes in. On top of quote unquote seeing the patients, other things that I'm responsible for include ordering and or managing labs and different diagnostic testing, refilling medications, reconciling medications for patients who may have multiple providers that they see, referring my patients out to specialists as necessary, and responding to secure messages that the patients send through our private patient portal. What made me decide to go into my field, and did I always know it was what I was meant to do? Very difficult question. In elementary school, I always wanted to be a teacher. Where I came to that conclusion of I wanted to be a teacher, absolutely no clue. It was just something that I said, hey, this is something that I would like to do. Got to junior high, 7th grade. First hour, I had math. I will never forget that teacher. But it was a huge reality check for me from elementary to junior high. And it was at that moment where I also realized that teaching was not going to be the thing for me. So how I settled upon nursing, no clue. But that was just the career that I chose. Once I got to high school and I began to look into colleges and majors and things of that nature, the only major that I ever looked into was nursing. So all of the schools that I looked at, I was really curious in regards to if they had a nursing program. And then within the realms of that nursing program, like what was their pass-fail rate? What was their success rate for their NCLEX? Things of that nature. While I was in high school, I was a candy striper, which basically is like a volunteer in a hospital. And then throughout the course of my nursing school, so I graduated high school in 2004. And very shortly after that, I think maybe 2006, into 2005, beginning of 2006, I did take a certification class so that I could become a certified nursing assistant within the state of Ohio. And so pretty much throughout the course of all of my bachelor's degree, I was working as a CNA in the hospital. So how I chose nursing, I'm not really sure. I've been in healthcare since 2006. It is the only field that I ever know. But what exactly led me to that decision, I don't know. I know what makes me stay in nursing today. I know what makes me love nursing today. I know why I have a passion today as someone who has been living and breathing this since 2006. As far as what geared me towards this profession back in 7th grade when I knew that teaching was not for me, that I do not have an answer for. What courses in college did I find most beneficial in preparing me for my career path? So you'll hear a lot of people in the healthcare field refer to the 3 Ps. And I would definitely say that those were the most beneficial, probably the most difficult classes, but definitely the most beneficial in regards to becoming a nurse practitioner. So your 3 Ps are going to be your pharmacology class. So that's the study of any and all things related to different medications, not only what they do, but how they interact with, other medications, how they interact with different hormones in the body, how they work, and somebody who's a very healthy individual versus somebody who might have 5 or 6 comorbids and some of their organs don't work effectively. So looking at medication in the realms of all of that. Pathophysiology, which is the study of how the body responds to diseases and or abnormal processes. And then physical assessment. Physical assessment, exactly what it sounds like. That's the class where we learn, how to take a blood pressure, how to count respirations, how to take a temperature, all of the little different things that when you're in your annual examinations with your doctor, the different things that they make you do or the different things that they're doing that you have no idea why they're doing, but those are all the things that we learn in physical assessment. Extracurricular activities that I participated in outside of regular coursework. I will be honest, in high school as well as college, I did not participate in any extracurricular activities. I am tall. I do get asked a lot if I ever played sports, but never played sports. I did play clarinet in junior high, but that did not trickle down into high school. For both, I literally would go to class and come home. Question 6, how did I maintain my focus to study and prepare for my exams and other coursework in my professional schooling? So for me I'm just a person, I don't give up. If I set a goal, my plan is to reach it. will I reach that goal in 1 year, 2 year, 5 years, 10, 15, 20? But I am the type of person that if and when I make a goal, I am determined to reach it. So, you know, a lot of it is just my dedication and determination to reach a goal. I can say, in all transparency, nursing school was not the smoothest ride for me. The program that I originally got accepted into partnered with another major university that was about 20, 25 miles away. And together, both of those schools had their nursing programs. And then that junior, senior year, both those programs kind of meshed together for the actual nursing program portion of the degree. And so, but the problem was, the school that I was at alone had 300 students in the nursing program. But where, like I say, where they split and they merged with the other school, that program only took 25 students from each college. So a total of 50 students. So, I mean, if you're looking at the fact that my school had 300 students alone and only 25 of us were going to be accepted, you know, very slim pickings. My GPA was greater than what they suggested it to be, but even still with that GPA, it wasn't enough to make that top 25, so to speak. So I did have a wrench thrown in my plans then. I did have to apply to another nursing school in the midst of taking prereqs. That other nursing school, I was accepted with my GPA. And so that was there. So at that time, I then transferred to that other nursing school once my prereqs were completed. Upon going there were some drastic changes. I can say something else that kind of kept me on my toes was having a conversation one day with the program director of the bachelor's program at that school. And she basically called me dumb to my face for taking 2 classes together. Told me that was stupid. Only a dumb person would sit and take those 2 courses together because they are very difficult courses and blah, 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 blah. So that too was a big thing for me personally, to be called dumb. As a program director, I think that even if you don't agree with the course route that your students are taking, that is a very harsh word to describe any students. So that also too was a huge thing for me to not only reach my goal of becoming a nurse, but also to prove this lady wrong, to let her know that just because this is the way I'm choosing to take my classes does not necessarily make me a dumb person. So I did end up obviously finishing that degree. Obviously, this was back in undergrad, so I've since went on and graduated twice since then. Things have come full circle. That exact same program director ended up leaving that school shortly after I graduated from it, moved to another school within the city. And when I got a job at that school, it was funny to be side by side with her. And actually, you know, at that point, look at her and, you know, we now have the same degrees. You know, that same person that you called dumb, you know, 5, 6, 7 years ago is now standing here beside you with equal level degrees. So as far as the part about the question in regards to preparing for exams and things like that. So the biggest thing that I can say is find out what works for you. What works for me, Nicole, may not work for you. So what works for Nicole is hands-on and visual. I am a very hands-on learner. I am a very visual learner. So videos are great for me. Being in a skills lab and doing hands-on things, those are things that get things to click for me. But does that mean that that's how everybody learns? No. I was in some study groups when I was in nursing, and our study group was composed of multiple students with multiple different learning styles. And there was a girl who flashcards were her thing. So every test, she would probably have a couple hundred flashcards with all of the testing information, but that's what worked for her. I'm not somebody who can sit down and develop all of these flashcards and think that, you know, sitting over dinner and going through these is going to make things stick for me. For me, can I learn that way? Yes. But for me, it by far is not the most beneficial way for me. So I would encourage you to, I mean, if you Google learning styles, there's a multitude of different tests that you can take to figure out what works best for you. Because in the realms of nursing school, once you get to the meat and potatoes of your program, there will be a lot of information thrown at you very, very quickly. And you will be responsible for all of that information. And all of that information may not necessarily be on your test or be on your quiz or anything like that, but do know that that information is vital. All of that information, you know, will somehow come back to you once you actually graduate school and you're practicing and you're in a hospital. So like I say, it may not necessarily be on a test or a quiz, but all of that information is going to be very, very vital. And so whatever method you need to use to make sure that you can not only remember, you know what I mean, remember and retain it, you're going to have to figure that out for yourself. Please give any additional information about yourself, work, professional interests, research projects, recent accomplishments, or personal interests. Not that I really don't have too much going on. I guess one thing that being asked to participate in the Do Influence that has kind of remotivated me in a way. One of my passions is to start a mentoring and or coaching program for minority students in their undergraduate programs. So being asked to participate in this has definitely kind of rekindled my flame for something that I have actually already created a blueprint for. It's kind of just been, you know, sitting on a USB. Some paperwork has been sitting in a binder, literally collecting dust. So that is one thing that I would really love to get up and running at some point in time. Like I say, it is a goal that I have established. I've been working on it, quote unquote, since 2012. That's at least when I developed the blueprint for it. You know, it's 2020. I haven't really done too much with it, but that is a goal that I do have, and it's coming. It's just a matter of, you know, how quickly I can gather all my resources and things like that now that I'm in a position where it's something that I can actually do. And then just any additional questions, tidbits. So only thing that I really would like to share for anybody looking to become a nurse practitioner. And by no means do I say this to kind of disengage you from seeking out this profession, but I do just want to kind of be transparent. One of the biggest things that I see, I'm in a multitude of different groups on, you know, different social media platforms. The biggest thing that I see is students who are in nurse practitioner school who have to sit an extra year or an extra semester or quarter, you know, depending on how their classes are structured, because they cannot find a preceptor. One of the biggest differences between that bachelor's and that master's, when you're in your bachelor's program, your school is responsible for finding all of your clinical sites, for hooking you up with a preceptor. All of that stuff is the responsibility of the school. When you get to your master's program, that responsibility falls on you as the student. So I would encourage anybody to who is looking to become a nurse practitioner to have some of that footwork already done. Obviously, things happen and things change, but I would encourage you to try to get some sites and or specific preceptors on your radar, because it is very, very disheartening to be in some of these groups and seeing these students who, like I say, are having to sit out a semester because they cannot find a preceptor. There are tons and tons of nurse practitioners out there, and obviously, you know, each state has their requirements on who can precept and who cannot and things like that. But try to have some of those ducks lined up just so that you don't become that person. I can say that I was almost that person and it's something that never should have even happened, but it was one of those things where I chose a nurse practitioner route originally that I did not want, but people kind of quote unquote forced me into so that I could become more marketable. And knowing that that's not anything that I wanted, I went with it, but then it was literally that clinical that I got to, and I could not find a preceptor to save my life. And so I ended up changing my route from a family primary care nurse practitioner to adult-gero. And with that, for me, I was able to continue and graduate on time. But like I say, depending on what you're trying to do, that may or may not be an option. So I would encourage you to try to have some of those ducks in a row so that you do not become that person who has to sit out a semester because you don't have a preceptor. Another big tidbit that I like to tell people is to keep all of your documentation regarding your licensure, certification, CEUs, all of that stuff. Keep all of that together. At the end of the day, you and only you are responsible for maintaining those things. All of those things come with expiration dates. So yes, you'll be granted a license for whatever state, but know that that license will expire. Yes, you will be granted with certification to practice as a nurse practitioner, but do know that will expire. DEA, I didn't talk about that, but DEA is something else that goes along with being a nurse practitioner, and that is something else that it will expire. Your BLS, your ACLS, if you have any of those, all of those things come with expiration dates. For some of that stuff, yes, you will get a reminder. Currently, I practice in Ohio and I have licensure in Ohio and Texas, and I will get like a 6-month reminder from both of those boards of nursing saying, hey, you got 6 months. But ultimately, at the end of the day, it's your responsibility to make sure that all of those things stay current. So keep everything in one place. So I have a binder literally with sleeves, and I have everything in there. So my BLS, I don't have ACLS anymore. All of my nursing licenses, my DEA information, my NP certification, all of those things are filed nicely. And behind all of that is all of my CEUs. That way, I know where to go to find it. The expiration dates are bam right there in front of my face. And then I can go to those prospective websites to renew all of those things, because what you don't want to happen is you cannot practice without those things. So if it gets to a point and you allow those things to lapse either on purpose or because you forgot, there in turn goes your job and you cannot practice. So for some people, if they're their only source of income, that can be very detrimental. For other people who, may have a spouse or something and they're not the only paycheck, cash flow can still, come in, but it still can be a major hit in your monthly finances. So I do encourage you to keep all of that stuff together so you know exactly where it's at. Not only for interviews, because if you go to an interview, they're typically going to ask for copies of all of that stuff, but also too, so that you can, like I say, know when things are due to expire, so you can make sure that you renew all of those things on time. And my third and final thing would be, if this is something that you really want to do, do it. Do not allow others to dictate your future. If you're thinking about this and you're in some of these groups, you will see a lot of negativity that's going to come with any professional choice that you choose. I don't necessarily care what it is. No profession is perfect. If being a nurse practitioner is something that you want to do, then I would encourage you by all means to make sure that you meet that goal. Like I say, do not allow others to dictate something that is made for you. So I hope that the information in this video has helped you in some kind of way. Obviously, if you go to the Do Influence website, all my contact information is there. Definitely feel free to reach out to me on social media and or via email for any other specific questions that you may have that I either did not answer in this video or you would like for me to elaborate on further. And I do wish everyone the best of luck as they do prepare to become a nurse practitioner, if that is something that is in their heart that they want to do. I definitely do wish you the best in your future educational endeavors.